there have to be some treatment and long-term solution. Who is a good candidate and who should avoid it?
Hormone replacement therapy. Ladies, let me say this, help arrived. It is amazing. It is amazing. Bioidentical hormone replacement therapy basically was developed and to basically assist women who are dealing with these issues. Now, who is a candidate? So let me first talk about who can benefit. As long as you're dealing with menopausal issues, you can benefit from it. Okay. For women who are in those fluctuating years, what we will look at is more like conservative types of treatment. We will basically just kind of decide, okay, what symptoms are you having? How might we take care of those symptoms from an individual perspective? However, with women who have leveled off, we absolutely, like I said, are able to take care of you, providing we can pellet you. Like I said, we can provide other topical agents. It just depends on what you want, right? What are the things that who cannot have it? What are the things that we focus on? If you have a history of certain types of cancer, we really are very cautious. We want to ensure that we are literally getting your history. We need your medical history. We need your lab so we can look at it. If you are seeing specialists, we want to talk to your specialist to make sure. So let's say you have a history of cancer. We want to talk to your oncologist to make sure that this is right for you, because we know everything is not for everyone. So we want to make sure that we're giving you what is right for you. If we're looking at the bioidentical hormone replacement therapy, we might look at you and, hey, you qualify for this. Woman A might qualify for it, but woman B might not qualify for it. What can we do? Can we look at other solutions like topical agents and that type of thing? Intravaginal vaginal agents. Those are things that we absolutely can look at to ensure that we're making sure that everybody, kind of, especially for the postmenopausal women, to kind of just get their lives back, so to speak.
Right. So how should diet and exercise change during this phase to combat metabolic slowing or menopausal weight gain?
So one of the things that I say to women, the things that you do in your 30s and your 50s will emphatically not work for you in those mid to late 40s and 50s and beyond. It's not working, right? And so exercise regimen, I just explained in this conversation that estrogen supports things like the bone in every system, right? And so a lot of times I will use things like B12, right? I normally like to use B12. How many people know we need B12? But how many people know what foods we get B12 from, right? And so it's a matter of ensuring that we're tapping into ourselves, that we're focusing on the right foods to eat. We're focusing on, because we know things like B12 supports red blood cell production. Where does red blood cells are? Within the bone system, right? And so all these systems ties together. So therefore we have to tap into an exercise regimen. How do we ensure that we are taking care of ourselves? We have to ensure that we're eating the right foods. We have to ensure that we are working out. We're getting up in the mornings and we're stretching those bones. We're working them. We are ensuring that we're including things like collagen in our diet, our collagen-rich type foods, right? Mm-hmm. We want to ensure that we are always trying to remain flexible. We want to move. Mm-hmm. We all know exercise play a crucial role. And so utilizing those means, I say self-care after 40, self-care for every woman should be paramount, because that is the only way we can escape with ensuring that we can live a healthy life after those perimenopausal and those menopausal years.